So for us, we've presented all our data to the government, and we're very excited that that disability services were part of the 1A rollout. However, no, we haven't been contacted as yet, and it has led to some uncertainty within our organisation and within the disability sector as well.
So how big is your organisation? How many staff and residents need to be vaccinated?
Yep, so in the 1A rollout, we have over 50 accommodation, so people's homes, and that's over 250 individuals, and we have 600 frontline workers that are waiting for the rollout.
So nothing has been administered so far?
No, we haven't had anything administered so far. We've had lots of information from the government. We've had lots of information, webinars, provided with information around the best way to get ready, to distribute the information across Easy Read, also through local health districts as well. But in terms of the actual contact to organise our vaccinations, no, we haven't had anything as yet. We're hoping, and fingers crossed, that will happen very soon, because also we're in the, as we all know, we're in flu season. And as an organisation supporting one of the most vulnerable groups, and with our frontline workers, our flu vaccination rollout is also due to happen over this time as well. So again, that we can keep the health and wellbeing of those most vulnerable safe. And trying to weigh both of those things up at the moment for our organisation and for many organisations is really, really difficult.
Okay, so we're 8 weeks into the rollout. 1A is the priority group. You've got 250 residents, 600 staff that need to be vaccinated. Have you been told why you haven't received these vaccines? Is it on the supply side, or have you not quite been ready?
No, we haven't been told why. We are getting our information via alerts, absolutely, via the government, with the changeover from the vaccines as well to now looking at Pfizer, where the majority of our frontline workers would be under 50, and also clients with a disability in that age group as well. We're just anticipating through the information that we've been received via the alerts from the government and from local health districts that we're on wait and watch.
Okay, so I'm just trying to work out why even residents haven't been vaccinated. Is it because, I don't know, they no longer fit under the AstraZeneca guidelines? I imagine that they would have been getting Pfizer anyway.
So for us, the way that the rollout was happening for individuals that were living in shared accommodation as part of 1A was that our understanding was that we provided each of those residences with the amount of house mates and the amount of staff members for frontline workers, and that they would be distributed per house. So we were waiting for health to then contact us to make times to come to each of those houses to administer, and we were facilitating that as part of the rollout.
Right, so have you done anything wrong, Kate? Have you got all your ducks in a row ready for this rollout to happen? You're just waiting for it?
We have everything ready to go, yes, absolutely. So we have consents. Those people with comorbidities or where there are health issues have all seen their GPs for advice, and that has worked with staff as well. So we are ready to go in terms of making sure everybody's available on those dates, all of our rostering, getting everybody together, and making sure that the residents have been informed, and their families, around Easy English, what that means, and what that means for them also coming into, as I said before, into the flu season as well, and how we'll be supporting those individuals.
Okay, so you need to get the flu shots as well. So, Kate Smith, just explain to me what happens without the vaccine. Are you taking extra precautions for your residents? What will a vaccine bring in terms of new freedoms for residents, but also, I guess, the peace of mind for staff?
Yeah, absolutely. So our pandemic response, obviously in line with all government recommendations, has had major implications for not just people with a disability accessing the community, accessing families, and just having the freedom of choice of staff, where they want to go and what they want to do. But also on our staff, as per the government regulations set back last year, was that we were trying to make sure that staff were on one-site rosters just to stop anything if someone did get infected, and to limit that as well. So what that has meant for us is that we've had to stay in one of our pandemic levels. So we make sure that obviously all of our screening's done. We have to limit activities. We're still making sure that we know exactly what staff are on, who's where. So our vigilance across all activities that people need to do is increased, which of course then what that does for a person with a disability in terms of choice and control and living their own lives means that there's an extra eye watching over and making sure we know exactly where people are going and that they are as safe as possible. So it leaves a lot of uncertainty within an organisation as well, to make sure that, as I said, that we have got the health and wellbeing of both staff, our clients and the broader community at first hand.